So let's talk about the Little Brushes Guide Module 1. On this, we will be talking about how important it is so that we can see the plaque and see the teeth and how the gums look like. So that is categorized as visibility. Second is that we have to take enough time to brush this plaque off. Plaque is not very easy to brush away. It's like, when you have like a watery slope and you get that slime. It looks like it's going to be easy to come away, but you got to really scrub it away. So plaques like that, it's a biofilm and it is very difficult to get rid of. So we need to give it enough time and care to get rid of all of the plaque. And the third thing is to make sure that we're monitoring the teeth and gums from one dental or dental hygienist appointment to the other. So those are 3 topics that we're going to discuss today. So visibility. I have had very many times when a patient comes and sits in my chair and we discuss brushing and they say they do a good job of the brushing and they're quite proud of their brushing. And then I put them back and I have a look in the mouth, and when I show them what I see with a good light, so we've got very good light at the practice and all dental chairs, and a good mirror, and when I show them what's inside their mouth, they're almost always shocked. So the fact is you cannot see inside your mouth. One is that the visibility, because the teeth are all tipped in, is very difficult, especially the lower insides. The tongue is there, saliva is there, and so people cannot see very efficiently. And so some of the tools that I do recommend for you to be able to see, one is make sure that you wear glasses usually. So if it's long-sightedness or short-sightedness, you wear your glasses. So most people brush in the morning and brush in the night without their glasses. So it's really important that you wear your glasses to see, or whatever tools you need to see. Second is having a good light. So making sure that you in your bathrooms are well lit so that you can have a clear look into the mouth. The third is some sort of a zoom mirror. So some sort of a makeup mirror. So the ones that I have recommended, one is mirror with light. So that's the one that I have, or just 20x zoom mirror. You can also get one of those mouth mirrors like how we dentists have, so that you can really see some certain areas of the mouth. This particular one has got a light as well on it, so you can see inside the mouth to help you again be aware of what your mouth's like. So think of it like this. It's like having a used pie pan, and somebody gives it to you and asks you to clean it, and then they blindfold you. It's the same thing. So you cannot, no matter how well you clean, you're going to miss out some of the areas in the pie pan. The same way the teeth are not straight. It's like in all sorts of curves. So you have to be able to visualize it and see it for you to be able to clean the teeth properly. So the pro tip given on this page is that every minute you spend looking after your teeth helps you spend less time with toothache and dental problems. And for every $1 that you spend on the different tools and gadgets to look after your teeth, you will save money on expensive dental treatments. Remember, the work that you do at home will negate the work that you need at the dental practice. So do take your time with your brushing. So the second thing is timing. Although about 2 minutes is advised for brushing, that's only for the teeth brushing. Then we've got to clean in between the teeth, we've got to clean our tongue. So all this adds time. I take about 3 to 4 minutes usually to brush my teeth, and I don't even have very crooked teeth. I had, but it's all been corrected with braces now. So I would say some children and some adults need a lot more time, but also remember that when you're starting to introduce your child to toothbrushing, even getting 10 seconds in, 20 seconds in, 30 seconds in would be great. So don't push the child, don't say, oh yeah, my dentist said 2 minutes. No, start slowly, but slowly build it up. But as your child grows, as a toddler, and as they grow, all they need is a good electric toothbrush and good brushing and good visibility. Everything else, like interdental cleaning and everything, can wait. Even tongue cleaning can wait. So it's a good idea to introduce it early, but every child's different. You've got to see but the most important thing is brushing the teeth efficiently. For timing, so I have given a couple of timers there, a 2-minute timer or a 3-minute timer. That's just to brush the teeth. And then there are these apps as well, which are very useful for children. This particular app has been very well recommended by parents. I haven't used these apps because my boys, by the time I got introduced to all this, it is way past our time for using all the apps. Another thing is there are lots of songs, 2-minute, 3-minute songs for brushing. I have actually got a compiled list, which I shall put in a link as a description, that check it at the bottom. So now, important thing, monitoring. So like I said, as soon as the teeth come through, I would recommend that you see a dentist or a dental hygienist or a therapist to apply the fluoride varnish religiously on the teeth to help the teeth avoid getting decayed. Because once one of the middle teeth gets decayed, then that decay causing bacteria flourishes. When that is given the chance to flourish, it's spread to all the other teeth. And when the adult teeth come in by the age of 6, there is that like a pot of decay causing bacteria in the mouth ready to cause decay on the adult teeth. Once you start getting decay on the adult teeth, it's a lifelong problem of pain, discomfort, money spent on teeth, loss of work, time off work, time of important, so you're having to be distracted from important things. It's just not worth it. It's so preventable. So we have to try and nail and avoid problems on decays on middle teeth, and that is good monitoring. So 6 monthly hygiene appointments, and then in between this, making sure that the brushing we do is really good. So like I said, general people are not good at picking up plaque. Plaque collects within 12 to 24 hours of a brushing or even a hygiene appointment. And the trick is to get rid of it religiously every 12 hours. There are 2 things. One is the Disclosing tablets. So it's just a tablet that you chew on, spit out, rinse your mouth out, and it shows your plaque in a different color. So the one I have recommended is Plaque Search, which shows the new plaque in one color and the old plaque in another color. So you can identify new plaques, which collects back fairly quickly, but old plaque is your problem area. So you're missing those areas, and brushing is such a chore that people miss the same areas over and over again. So it's a really good idea for you to identify your problem areas, start with your problem areas, and then go on to brushing other areas of the mouth. Also, it's a good idea to take photographs so that you can see if you're improving. Or for children's photographs to make sure that you're keeping things at bay, or you can compare 1 month to the other or 1 week to the other. Few problems with the Disclosing tablets, it's really hard to get rid of. So you want to use it maybe after brushing at night on a Friday evening. So you got a couple of days to get rid of it. Make sure that you put dark clothes, you put lots of Vaseline on your lip, tongue, cheeks, so that it's not getting stuck in those areas, and trying to get rid of it. So it's all plaque. Plaque is the bacterial load that gets collected on almost all the surfaces of the mouth. The incisal third, that is the bottom third of the teeth, are usually clean because when you bite onto food and saliva and everything doesn't keep it there. So it's usually near the gum that the plaque stays. So that's the most difficult area to clean. Now, plaque, it's a battle between you and the plaque. Plaque's trying to stay on your teeth. You're throwing things at it to get rid of the plaque, like brushing, interdental cleaning, mouthwash, toothpaste, toothbrush, everything at it. So what the plaque does is it tries to build a fort. So it absorbs the calcium from your saliva and starts to go hard. Now, the hard plaque that is called as calculus or tartar does not really cause a lot of damage, but what it does is your teeth is very smooth, so the plaque can be easily cleaned away. So the calculus becomes hard and it gives a rough surface onto which more plaque can adhere, and thus let the decay causing bacteria can flourish better because it's not brushed away. So what happens is the bacteria sticks onto the plaque, the oxygen is absorbed, and they create an anaerobic, that means an oxygen free area, which is where usually the more virulent bacteria, the bacteria that decay causing, gum disease causing bacteria, flourish in an anaerobic, that means no oxygen layer. So that's what the calculus forms. Anyway, so our trick is to make sure that the plaque doesn't go calcified. Usually it takes about 2 to 3 days for some people. but can be as early as 2 to 3 days, but usually about 5 to 6 days. So the trick is to get rid of the plaque before it goes hard, because once it goes hard, you will need a hygienist to use either an ultrasonic scaler. There are a few other types of scalers to get rid of the plaque, and that's the only thing that you can do. No matter how well you brush, so I see the hygienist every 6 months, no matter how well you brush, it's really hard to clean every area of the mouth. And to avoid problems, I always recommend seeing the hygienist 6 monthly wherever you are. As an adult, children, not so much. I don't like children having a hygiene appointment because it can really scratch the enamel. The enamel is still really newly formed, but only in cases where I feel like we cannot be done. That's the only time that I recommend you see the hygienist. So our trick is to get rid of it before it goes hard, and the best trick on the market is Disclosing tablets. I've also put a Disclosing toothpaste that's called Pixta, which is very good, not as good as the Disclosing tablet. So you just use it as a normal toothpaste, but you got to use a particular light, and it shows the plaque in fluorescence. It just absorbs the cells of the bacteria, just absorbs this material that makes it fluorescent. It is not bad, but it's not as good as a Disclosing tablet, but you can use it more often because it's just like a toothpaste. So these are the two tricks of monitoring the teeth and the brushing, and making sure that we are keeping as well as possible on top of it before we have to see a hygienist. So hope this is helpful, and I shall see you in module